Hey everyone, Dr. Ziad Dahdul here from fflockerroom.com. This is Fantasy Injury Monday. Thanks for checking in again. We're going to go over. It's actually going to be a Cowboys themed report today. So we're going to go over a lot of the key injuries for the Cowboys that they suffered not only last season but heading into this offseason. So I want to kind of just touch on the updates on some of these guys. As we head into training camp and see where they're coming along and see who's actually going to be back and ready to go for this year. So it makes sense we start off with, quarterback, Tony Romo, kind of the center of the offense. As he goes, the offense goes. And, his injury is interesting because he's had this injury multiple times in the past. The only difference this time is that they actually had some surgical fixation of the clavicle, which is the collarbone. And what they did is they also did something called a Mumford procedure. Essentially what it is they take the very, very tip, the end of the collarbone, the clavicle, and they remove the piece of it that tends to get driven into the ground. That causes when you hear somebody having a separated shoulder, when they get driven in that ground and they sprain those ligaments that hold the shoulder together. And so what they did is they removed a little piece of that bone off of the edge. And sometimes what that does is it helps with pain levels. It helps with overall mobility of the shoulder. If there's a lot of arthritic issues, degeneration from repetitive injuries, which he's had in the past. And so that's nothing new for him. And so the idea is that they're trying to offload some of the forces that get put through that shoulder. If he does happen to get tackled or driven into that ground, hopefully the forces dissipate a little bit better and he doesn't suffer this injury again. From a functional standpoint, throwing wise, he's going to be fine. There's really no issues with him until he actually takes hits. That's going to be the biggest thing, whether it's a fear issue, or he has best offensive line in football. So that's definitely one thing to keep in mind. But he should be fine. He should be healthy. Really, going into the season, you rank him where you normally have him, and you just kind of hope that he doesn't suffer one of these injuries, and that's really the biggest issue with him heading forward. I would draft him with confidence and not worry about the injury risks. He is going to have a little bit more of a chance of this happening again because he's had a couple of these in the past, but you kind of just take it for what it's worth and you draft him and you go from there. Next guy, we're going to talk about kind of this crowded backfield. So the Cowboys went out and drafted Ezekiel Elliott at Ohio State, number 4 pick in the draft. And he's, by all accounts, expected to be the lead back going into this season. Going into camp, the Cowboys have a crowded backfield because they went out and signed Alfred Morris. We have Darren McFadden, we have Lance Dunbar. There's a lot of guys, a lot of mouths to feed, and what I wanted to do is I want to touch a little bit on some of these guys that could potentially steal some carries from Elliott heading into the season and give you some updates on kind of the their injury status at this point. And so, first guy we'll discuss is Lance Dunbar. Lance Dunbar is coming off a pretty gruesome knee injury. Suffered it in week 4 last year. Not only did he tear his ACL and his MCL, but he also suffered a patellar tendon rupture, which, you don't see very often. It's very uncommon. And we've kind of seen with guys like, Victor Cruz with the Giants, how difficult it was to come back from that patellar tendon tear. And then you throw on top of that the instability that presents itself with an MCL and an ACL tear. And that typically by itself, without the patellar tendon tear, takes 6 to 12 months. And so you factor in the patellar tendon tear with that taking usually a year just in and of itself. I have a very hard time believing he's going to be a major piece of this offense at all this year. I mean, there's some talk about him, running some routes on the side, which he was doing last week or a mini camp at the end of June. I just can't imagine somebody coming off this type of gruesome injury and being able to come back and contribute at all, especially with their crowded backfield, because there really isn't a necessity for it. They signed him, and I think maybe it was more a depth issue, maybe taking care of the guy. I don't know what the case was, but I just can't imagine he's going to be a big part of this offense heading into the season. I would expect to, for him to really not factor in much at all. And it would not surprise me if he's had it all year. You talk about somebody who needs 12 to 15 months minimum in my mind to come out back from these 3 injuries and these 3 structures that he tore. So expect him to not be a factor in terms of taking carries away from Elliott. The other guy is McFadden. McFadden's coming off another 1,000+ yard season, his second one of his career. It's his first time in his career that he actually played 16 games. He had some bumps and nicks and bruises. I think he had a couple of issues heading into the end of last season, but overall he held up pretty well and he had a pretty productive season. He was very effective out of the backfield, and so I can kind of see McFadden being a little bit more of that pass catcher out of the backfield to spell Elliott. But Elliott's coming out as a 3-down back, and somebody like McFadden with his injury risk is kind of hard to want to rely on him, week in and week out and give him a significant amount of carries. But he suffered a fractured elbow in the offseason. And, this happened sometime in June. And so, you expect that to take roughly 8 to 12 weeks, in that 2 to 3 month range. and it looks like he's on track. He had surgery, repaired it, all is well. It's just a matter of getting him comfortable carrying the ball again. Falling onto that elbow, being able to extend that elbow fully with range of motion and with strength to block. For pass protection, it's all those little things. But in terms of the injury itself, this is not something that's going to affect him greatly. I think the crowded backfield will affect him a lot more than anything else. I still think at the end of the day, it's Ezekiel Elliott, it's Darren McFadden and Alfred Morris kind of vying for some backup carries, and I don't think Lance Dunbar is going to factor in at all. So hopefully that gives you a little bit of insight in terms of what these guys are coming back from and how important some of these kind of injury risks are. And just to kind of summarize, I think Romo, I think Des Bryant, a full year removed from that fifth metatarsal fracture. I think those are two guys who are going to be very undervalued, and they're going to be labeled as injury risks. But I think those guys are full steam ahead, and I think you draft them and you get Des somewhere in the second round. I think you're getting a steal of a deal with him. I have no worries about that foot heading into this season. We've seen it with Julio Jones, Julian Edelman. There's a lot of these guys that are coming off of that injury, and I think they're going to be full speed ahead going into the season. So as always, if you guys have any questions, find me on Twitter at Z_Dahdul. Tag any of your tweets with the hashtag AskDrZPT. And I'll answer any questions that come up. And, if you have any injury questions, any questions about fantasy football, go to fflockerroom.com. All of my content, we have amazing writers, got a lot of fresh, new blood coming onto the site this year. I think definitely want to take a look and check out some of the content that we got going on. All right. Until next week, guys, see you next Monday. Have a good week and, talk to you soon.